Hello, everyone. I am Lorna Dale Charles. This evening, we are doing a session, an educational outreach session in collaboration with GRENCHAP, the Grenada Planned Parenthood Association, the Ministry of Health Grenada, with funding from the Canada Fund for Local Initiatives. Now, through this educational community outreach program, the collaborators are seeking to address the lack of access to comprehensive, integrated, client-centered, including youth-friendly sexual reproductive health and rights, HIV and gender-based violence services in Grenada. This is one of 4 community outreach sessions that we will be discussing. Our first topic today is sexual and reproductive health and youth. I have with me the members of the Youth Advocacy Movement, YAM, in Grenada. Now, guys, welcome to the program. I would ask each of you to introduce yourselves before we get into our discussion today. I suppose we go with Zanelia.
Hello, everyone. My name is Zanelia Joseph, and I'm currently the president of YAM.
Hi,
Makia.
my name is Markia Ford, and I am one of 2 PROs at YAM.
And last but not least, Nia.
Good afternoon. My name is Nia Jeremiah, and I am also one of 2 PROs from YAM.
All right, lovely. So, guys, tell us, what is this youth advocacy movement in Grenada?
The Youth Advocacy Movement is a group of young adults whose primary aim is to educate the youth about their sexual health while also promoting safe sex.
Okay, and why do you guys think there is a need for that youth advocacy in Grenada?
With the Youth Advocacy Movement, we promote safe and consensual sex by educating the youth about their options in terms of contraceptives and what's really best for their body. Now, there's also a stigma surrounding sex among youths. With YAM, we also try to break that stigma to get everyone really comfortable enough to speak about sex, especially coming from a dominantly Christian populated country.
Okay. So I know you one of the issues that you guys will be addressing is, I guess, is sexuality. So what are some other social issues that uniquely experienced by our youth in Grenada? From your perspective, what are some of those?
In Grenada, the youth experience many social issues, things such as poverty and teenage pregnancy, things such as colorism, gender-based violence, homosexual stereotyping towards girls and boys, that they act a certain way, they're stereotyped, even though that might not be the case. And this is due to Grenada's lack of awareness on sexual health, because sexual health isn't only just dealing with sex itself, but with everything involving a person's sexuality, how they interact with others and with themselves. So us at YAM, we try to break those stereotypes by teaching the youth how to go about on a daily basis, how to learn about themselves and dealing with other people so that they could teach, younger people or even their parents and so on. So that way the whole nation could get educated.
Lovely. So give us some more details. Why should young people have more access to a comprehensive sexual education in Grenada's case?
Well, I think for years we've been undermining any curiosity that any teenagers may have concerning sex. I think our great-grandparents, our great-great-grandparents, they believe that if they educated us, then they're encouraging us to take part in sexual activity. This abstinence-only education is not working, and there is a place that we need to add in, to use a new method in place, which I think would be comprehensive sexuality education. And we believe by giving young people access to comprehensive sexuality education, we're empowering them to take control of their sex and their sexual life, their reproductive health. And by that way, we may be able to control the rate of teenage pregnancies and the rate of STIs and STDs that's going on in Grenada.
Absolutely. I mean, for a population of Grenada, and if that is true, because you said unofficially, if that is true, then it's a very scary experience for our future generation. One can argue. Of course, there are treatments and so on, but it's still very, very scary. So why should people have access to contraceptives? Like the different types of contraceptive offered, for example, in the case of the Grenada Planned Parenthood Association, and all the other sexual reproductive
People need
health
to have
services.
access to contraceptives and sexual reproductive health services, especially in Grenada, because this helps us not be scared of the topic of sex in general. the reason why a lot of us are scared is because we don't really know how to move about it, how to, go about sexuality and having sex. So if we break that by introducing people to different ways to be safe having sex and being safe with yourself, with your body, and with other people's bodies, it helps you to not be scared and to know that you're going into it in a safe way. So us at YAM, we have many contraceptives and so on to help us give out to the people so that they don't feel scared. So we have things like condoms, we have IUDs, we have STI screenings and so on. We have pap smears. We could test you. We could test you for pregnancy. We do all these things. We do urine screening and so on. So if you guys are ever scared, you guys would come to us first. We'll make sure to be safe with you. We won't spread your business, nothing like that.
But there might be a kickback to that because, as you guys rightfully mentioned, we are a Christian society, a strongly Christian society. Now, I remember a few years ago there was something about talk about introducing contraceptives at the secondary school level, and there was a kickback for that, right? How then do we go about? Yes, we've seen the rise of teenage pregnancy. No, we've seen the rise of sexually transmitted diseases. How do we go about addressing that? Maybe you guys have a method, because I would not want to send my child to school. Some parents may not want to send their child to school, and they're being taught or introduced to, okay, this is a contraceptive that you should use if you're sexually active or you're going to be sexually active, or this is the method that you have to take if you want to avoid, I suppose, pregnancy. No, there's a thin line there because some parents definitely may not agree to it. Some may agree to it. What is your guys' method in reaching the youth, your colleagues, your peers, and also reaching out to their parents? I suppose any one of you can answer.
Well, I would say, firstly, YAM recently started like last year. So we're a part of TAMCC community, and we've been encouraging our friends to be a part of YAM, and we've been encouraging them, about what YAM is and why they need to be a part of the association. We've been trying our best to recruit new members so that they would also come into YAM and learn why they need to be a part of YAM, learn about their bodies, their sexual health, and all these things. But in future wise, we are aiming to do community outreach. In that way, we would reach the parents before we reach the students, and then hopefully in the future, then we can go out into schools and really teach and motivate.
How then do you guys bridge the barrier of a Christian society? Like, some parents might be generally open to it, but what if let's say the church fraternity kicks up against that? Because again, I remember, like I said, there was a couple of years when something similar was being discussed and it didn't happen. But as I think as Nia mentioned, that you still see the rise in sexual transmitted diseases. You still see the rise in teenage pregnancy. Are you guys having conversation with, let's say, the Grenada Churches Association in Grenada, or not yet? Well, that's a plan. I don't know, because I think it needs to be dealt with holistically. So why you guys might be targeting your peers, there are other, I guess, pieces of that puzzle that need to work in sync for it to really work, because it is going to be a problem for our communities. It's going to be a problem for our society on a whole. So is there a plan to do that? I guess the president could answer that question. I'm not sure.
We know there is not a plan as yet, but that is a lovely idea that we can take into consideration. Hopefully, maybe we'll try our best to reach out to that community and see what's the best we can do. But for now, we're trying to encourage our peers, and hopefully our peers encourage their parents, and their parents encourage their friends, and we slowly open up minds.
Okay, so I want to, I guess Makaya was telling us the different types of contraceptives. Let's go through them I guess, step by step, and maybe you want to single them out what they're used for, like each one of them. So you can give your peers a better idea, because you might just say condoms, and they're female condoms, they're male condoms, because we're not just talking, let's say, to the females. I know we have a strong female congregation here on YAM, but there's also the male aspect of it that you guys might want to address. So you want to go through the different type of
so
I guess if it's
when
a
we
pill,
mention
the
condoms,
injection,
as you said, we have female and male
types of
condoms. So you
contraceptives.
know that they
Can you
prevent,
tell
getting pregnant, first
the
of
audience
all.
more
That's what
about
we know.
that?
But they also help you prevent getting things like STIs and STDs. And that's why we're so heavy on need to use condoms and practice safe sex, because instead of just protecting you from one thing, you're getting protected from multiple things, some things that can't go away, like certain STIs. So, yeah.
One might talk about, I guess, oral sex. How then do we address that issue? Because it's not just about sexual intercourse, but there's other methods, no? I don't know. You tell me. How then do we prevent those things? Because I guess there's a holistic approach in terms of your body, right? As one of you mentioned. Yeah, Naya?
Yes, I was going to say, I know that there are flavored condoms for the specific use of oral sex. So that is an alternative.
Oh, good to know. What are the barriers young people are facing in accessing contraceptives and other sexual reproductive health services in Grenada? What do you guys know? Tell us.
Well, we recently just spoke about one, which is religion. They may be coming from a religious household that does not believe in that only preach abstinence only, and they're maybe a bit uncomfortable with speaking about sex and sexual health and reproductive health. So that may be a barrier. Also, persons may be they may be scared that their business may get out. But at GBPA, we preach confidentiality. We do not. We stress on it. We do not. Your business is never going to be outside. Everything is kept confidential. So I think that there's this stigma that people think, oh, if they go inside there and they know a person, that person is going to tell their business out elsewhere, or that somehow, some way, if someone sees them walking up the step to GPPA, that someone may say something. So I think that is this kind of stigma. That's why they stay away. I think they may also be ashamed for the reason that they may want the service. It may be if they have an STI, if they come in to get an STI screening, they may feel ashamed, or if they're coming to see if they're pregnant, or if they're coming for an IUD to prevent, let's say they may have 5 kids and they're coming to get an IUD. They may be ashamed of their situation. But at GPPA, we do not judge, and your business is kept confidential. And we stress on that. Also, I think the big issue, the big barrier would be not being able to afford the services. I think a lot of people, they want the service, but they're just not able to afford it. So that may be the problem. And that's why we're currently having a free clinic going on right now at GPPA. All the services are free. You can get a pap smear, you can get condoms, you can come get an IUD, you can get Depo. I'm not sure if you know what Depo is, but Depo is the pill. Is not the pill, the injection, sorry. That it lasts for about 2 months, and it's birth control. And you can also get pills. For the men, you can come get a prostate exam. There is STI screening, and there is breast exams for those who may be concerned that they may have breast cancer in their family, and they may just want to come and check up. So there are these things going on right now.
Okay, that's good to know. So you said some persons may not have the funding based on, I suppose, their social economic status in the society, and they may not have the funding to go and get these tests. On average, can you say like what's the cost of it? I know you mentioned, yes, there's a free screening right now that is happening for the month of February and well, January is almost finished. So we have one more day in January, so you can get your screening tomorrow, the 31st, and then for the entire month of February, right? So what on average to say is the cost?
Okay, so I'll just list a few. Condoms are $1 for one. There is emergency contraceptives pills. The one pill is $15. The two pills is $20. There's Depo, which is the injection that I just mentioned. That is $45. To get an IUD, it is $250. To get an IUD removal, it is $150. To get an IUD check, it is $50. Hormonal IUD is also $250. To get a pap smear, it is $45. If you want a disposable pap smear kit, then it is $90. There's cryotherapy, which is $250. A breast exam is $30. To get your glucose checked, it is $5. Your blood pressure also $5. Your pregnancy, to get a pregnancy test, it is $10. If you want educational services, it is $30. Prenatal check, it is $100. $270 including the blood tests. If you come up for a follow-up check, it is $75. An ovulation kit is $50. And the urine screening test is $5. Now for the STI screening, I think that is where the problem lies for some people. Hepatitis B is $10. Syphilis is $10. Hepatitis C is $15. Chlamydia is $40. Gonorrhea is $40. But I think that people think that those prices would be more. So rather than they come and ask, they just assume.
To just stay away. Okay,
Yes.
I understand. So that's some of the services that the Grenada Planned Parenthood provides to all Grenadians, no matter where you are. What's your location though? Because are there other places that, if you're not, like, I think it's in St. George's. If it's not in the St. George's area, is there other places in the communities that persons can go, or they have to come to St. George's? Because if we're catering for the youth, they're all around us. So is there any way else other than the Grenada Planned Parenthood?
No, well, we currently only have one building, but like I said, there are free clinics going on, and we go out into the communities Tuesdays, Thursdays, and Saturdays, where you can come and get your free services so that you don't have to go down to town, but you can come. If you're in the area, you can come and get your services done.
I suppose that is something that really needs to be out there in terms of speaking with the community members, doing community outreach and educating, so that parents could probably take their children and they could get the necessary information that they need. Because as was mentioned, sometimes your parents don't want you to I guess the idea of sex or sexuality, if you have a different sexual orientation, it comes up and some parents can't deal with it. I suppose that the Grenada Planned Parenthood provide those counseling service that I suppose a parent cannot pass that information on to their child. The Grenada Planned Parenthood would be able to sit with a young person or a young adult or even a mature person, because older persons are as well coming on from, I suppose, our history, as was rightfully mentioned. Sex and sexuality or intimacy or sexual intercourse is not really discussed at the home. Most of the time we hear about something sexual is when you're doing probably family life, health education in schools, right? In primary, at the primary and secondary school levels, but they give you just a little bit. And of course, the religious connotation always seems to take over in terms of the abstinence, right? Sex before marriage is a sin and so forth. So you're saying that there are services, that counseling services that parents and child, or if a young person wants to know more, they can go into the Grenada Planned Parenthood. Yeah?
Yes, they can.
Okay, so I guess my final question is, since there is the free clinic, mobile clinic that's happening for the latter part of January and for the entire month of February, can you tell the audiences where they can access those services and on the days and the times that the mobile clinic will be passing through the different I suppose, communities?
Yes, so tomorrow, which is the 31st of January, there is a clinic at Florida Medical Station, which is from 1 to 6 p.m. On the 2nd
Florida in St. John's?
Yes,
Okay.
Florida and St. John's. On the 2nd of February, there is one in Union / Samaritan Health Center, which is 1 to 6 p.m. There isn't on the Saturday coming because I think we're kind of preparing for the holidays, so we left that out. But the next one is on the 9th of February, which is in River Sally from 1 to 6 p.m. That is a Thursday. The next one is on the 11th of February as Hermitage, which is from 1 to 6 p.m. The next one is in Carriacou. So yes, we are not living out the styles. The next one is at Carriacou on the 15th of February, which is from 1 to 6 p.m. And the 15th, the 16th, and the 17th, we are in Carriacou. The 15th and the 16th is 1 to 6 p.m. And the 17th is 9 a.m. to 12 noon. The next is at Sutter's, which would be our last clinic in Sutter's, which would be from 1 to 6 p.m. on the 21st of February. And our final clinic is on the 23rd of February, which would be at Guave from 1 to 6 p.m. on the 23rd.
So we don't have any happening in St. Andrew or St. George? I don't think I heard St. Andrews anyway in St. Andrews.
No, they wanted to target the parishes where they do not see much persons coming to the clinic. So that way we wanted to go out and reach people who did not get the service or are not coming to the clinics. So they targeted St. John's, the St. Mark's, and the St. Patrick's area.
Okay, understood. Well, guys, thank you so much for our informative session. I hope the information that you have given us here today would reach the right people and has not fallen and will not be falling on deaf ears. I believe that more discussion like these needs to happen in our different spaces. And I thank GRENCHAP and the Grenada Planned Parenthood, of course, the Ministry of Education, and with the funding from the Canada Fund for Local Initiative, for thinking about such a program and understanding why it is necessary for the tri-island of Grenada, Carriacou, and Petit Martin. Those are discussions that we need to have. Sex is too tabooed, and at some point everybody is engaged in it. And I suppose we need to have more open and honest discussion about sexual and reproductive health amongst our youth in Grenada, Carriacou, and Petit Martin. So thank you so much, guys. And I would say that you did an excellent job in representing YAM here today. So thank you so much.